Hi, ladies. Welcome back to Chubby After Baby. Uh, be sure to like, comment, and subscribe and download our app. It features a lot of latest and late breaking news and things like that, uh, articles, recipes, workout tips, free things, where you can get free diapers, and so forth. Okay, so now that the introductions have gotten out of the way, so one of the burning questions that I've heard is, mothers really concerned about whether or not they can pass COVID through breast milk. And I know a lot of moms just sort of do the breast pumps. And maybe we'll do a future video about types of breast pumps and things like that. But for now, let's kind of talk about the whole COVID pass-through breast milk. So, I just did a quick Google search, and I thought it'd be great to just kind of go over some of the answers that were coming up. All right, so the first one, definitely always want to keep up with the CDC. So in theirs, and like I said, this is the first time I haven't even gone through all this. I wanted to sort of go through this with you. So yeah, okay. So current evidence suggests that breast milk is not likely to spread the virus to babies. That's awesome, right? COVID vaccination is recommended for people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. In addition, anyone who's eligible, including those who are pregnant, breastfeeding, or trying to get pregnant now, should get a booster shot. Okay, wash your hands, obviously, for breastfeeding. Yes, so I definitely wonder, if you and comment below, right? If this is you, do you, like sanitize your nipple before you use the machine or sorry, machine, before you even use the breast pump or before you, breastfeed the baby. So yeah, I would love to know, what your take is, what your opinion and what you do, because every mom is different. Let's see. Oh, they suggest you wear a mask while breastfeeding and whenever you're within 6 feet of your baby. Um, I'm looking at this and my first thought is, how often are you not within 6 feet of your new baby? Now, if he or she, I always say he first. But if your baby, right, is 0 to 6 months, I don't know how much time you're going to spend, more than 6 feet apart unless they're napping, right? You know, you may have put them in something, but you're constantly they're there, right? They're watching you. And uh, yeah. So I don't know. I don't know how realistic it is to constantly stay 6 feet away from your baby. Or to so yeah, just I'm gonna leave that up to you. But this is why we're doing this. So um yeah, yeah. um yes, you've always wanted to use your own breast pump. I definitely never share. Um Even if you get them secondhand, you definitely want to give it a really, really good wash. And it's recommended that you wear your mask uh, while breastfeeding and to wash your hands with soap and water for at least 20 seconds before touching any pump or bottle. That's interesting. So I guess you wash your hands and wait the 20 seconds. Did anybody else suddenly think of like putting on a microwave timer, right? Like you just hit like the 30 seconds and you're good. But I guess if you touch it, sort of defeats the purpose of like washing your hands. Oh, snap. It just hit me, right? You set the microwave to the 20 seconds and you spend the first 10 seconds washing your hand. Boom. It's done. So when the microwave's done, you're good to go. You're Oh my goodness. Yeah, I know that just came to mind. And just being silly. It's a beautiful day and I feel like, people don't laugh as much. So there it is. That's one of your laughs for the day. Uh, okay. So that's what the CDC is saying, that breast milk is not likely to spread the virus to babies. Check. That is a good thing. All right. And this is kidshealth.org. Da, da, da. Okay, same thing. Coronavirus has not been found in breast milk. But here it is. But new moms with COVID could spread the virus to their infant through tiny droplets. They spread when they talk, cough, or sneeze. And they're definitely recommending that you talk to your doctor whether or not you should continue breastfeeding. Yeah, definitely. So this would probably be a good time to be like, this is not medical advice. uh, this is us researching this together, and I would always recommend that before you do anything, you consult your doctor or physician and get their take on it. So, boom, disclaimer. Um, So yeah, it looks like it's just pretty standard stuff, right? Wash your hands before you touch the baby. They also recommend you wearing a mask during nursing. Uh, Again, wash your hands, and then I don't know. I feel like uh, let someone in your household who is not sick give your baby the express breast milk. Yeah, I mean, I feel like that one's a little common sense. If you're sick, or your husband, sister, significant other, whoever in your house is sick, you obviously don't want them feeding your baby and or holding your baby, um, right? That's kind of one that's been around since pre-COVID. I feel like the world's being divided now between pre-COVID and post-COVID. Sort of like there's like this mark or line that's been drawn in the history books. Um, and so we'll all have pre-COVID and after COVID now. So you know we're titling this one pre-COVID, right? Not to give your baby to someone who's clearly not feeling well. Um, and if you're feeling well, and they give you the list of COVID symptoms, right? Fever, coughing, trouble breathing, um, and you can read the rest of it. Headache, lost taste and smell, nausea, vomiting, diarrhea, tiredness. So like I said, definitely always consult your physician. And let's go to the next one. And I mean, you could just kind of scroll down. But you can also look through some of the common questions. I would definitely say the like just kind of pay attention to where the information is coming from. Someplace like the CDC is definitely much more trusted than some random site. That's also a CDC site. I will say Google's been really good about giving CDC information and things like that. So just, kind of keep that in mind. And this is why I always say definitely talk to your physicians. So this site is actually talking about how breast milk could pass along COVID immunity. Vaccines widely spread. Okay. This site says the CDC recently confirmed the safety of the Pfizer and Moderna vaccines for expectant mothers and babies in its largest study to date. You can click there to actually see the study. Do-do. Okay. And I mean, and you can really dive deep into all these things to kind of figure out what's going on, right? So, the background of this case study is many pregnant persons in the US are receiving the messenger RNA, mRNA. Um, and I think RNA was it ribosome or nucleic acid or something? Don't quote me on. I have not been in biology class in quite some years. All right, so coronavirus disease, vaccines, but data was limited on the safety in pregnancy. So then it tells you the methods. December 14th, 2020 through February 28th, 2021. We used data from VSafe after vaccine health checker surveillance system and VSafe pregnancy registry and the vaccine adverse event reporting system to characterize the initial safety of mRNA COVID-19 vaccines in pregnant persons. So they're just telling you kind of like where they got the data from. So the VSafe and checker surveillance system and the VSafe pregnancy registry. And they're kind of telling you the results, right? So of the 35,000 VSafe participants, 16 to 35 years of age, identified as pregnant, reported more frequently among pregnant persons than non-pregnant women whereas headaches, myalgia, chills, and fever reported less frequently. So it looks like they tested 35 people for the VSafe. And let's see, 3,000 enrolled in the VSafe pregnancy registry. And they just say, completed. Include return. Okay, so they're talking about no neonatal deaths were reported, not directly comparable. Okay, so they're saying their preliminary findings did not show obvious safety signals among pregnant persons who received the vaccine. However, more longitudinal follow-ups, including follow-ups of large numbers of vaccinated women, necessary to inform maternal, pregnancy, and infant outcomes. Okay, so you can definitely continue to read all this, but from what I'm reading, and again, feel free to go back and read this. But right now, it just talks about that there are no, like I said, the no neonatal deaths. But I would say reported is it's questionable because, you know, what if there were some, then they just weren't reported. But basically, it says that, you know, so far it definitely seems safe, but more follow-ups are definitely needed. And, you know, you could say that about, you know, anything that, you know, this whole, you know, COVID's definitely been an experience for all of us. And so you know, I would definitely encourage anyone to get vaccinated. However, I respect the fact that it is an individual choice. And the only thing I can do is share with you um, some of the information that I found just doing a simple search. And like I said, this is just a Google search, and you can type this in and find out all this information yourself. And, you know, oftentimes, you know, as we don't really do that, just not necessarily intentionally, but just because it kind of gets put back on the back burner. So, according to the CDC, again, and we just kind of read that, that um, breast milk does not pass on um, COVID to newborns. And that they recommend that you wear a mask, you wash and sanitize your hands 20 seconds beforehand. Um, and obviously, again, you know, if you have COVID or, you know, somebody else you know has COVID, you know, don't feed the baby. um, so yeah. Uh, you know, I wish you all the best of luck and a beautiful day and a, you know, happy, wonderful life. Um, and, you know, again, be sure to like, comment, and subscribe, download the app, and, you know, stay tuned for more of these videos, right? We're just gonna kind of keep covering a lot of information and just share with you what's out there. Okay? All right. Have an awesome day, and I'll check you out later.